Hello, we are Group 7, and this is our first video assignment, number 1. My name is Ahaz Bhatti. I'm an informatics major, and I'm going to graduate in June 2020.
I'm Christine. I am a fourth year informatics major, specializing in HCI.
I'm Dara. I'm a fourth year informatics major.
I'm Lizette. I'm a fourth year bio major.
I'm Udit, a fourth year informatics major.
So first, I'll be talking about the HIMSS paper. So HIMSS stands for the Healthcare Information and Management Systems Society. So a common question that is brought up is the difference between health and nursing informatics. So health informatics is the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. Nursing informatics is a specialty that integrates nursing, science, computer science, and information science to manage and communicate data, information, and knowledge in nursing practice. So health informatics and nursing informatics both utilize computer and information science, but health informatics deals with managing healthcare information, whereas nursing informatics is used in actual practice.
So the clinical implication of this is that much more patient data is being collected. What this means is that there's a rising demand for people with certification or experience in both informatics and medical fields, which is being met by establishment of professional level education and certification for physicians in informatics. The managerial position in terms of information systems is a role that has responsibility of interpreting information and modifying data to be used in the decision-making process. It's important for them to understand the technology being used in case of mishandling electronic health records.
Policy implications. It's important that health professionals and government should coordinate their objectives and govern the officials of the state and federal government. With this, policymakers are now able to utilize data collected for decision-making in issues in public health. And because of privacy issues, organizations must make policies that guide use of telepath and communication. Summary of the paper. Health informatics and informatics are very similar for making new health systems, and it's important that all participants remain coordinated. And it's crucial to ensure public trust in our health systems and provide safe and effective care. So basically, nursing informatics is a subset of informatics where new technology is always being developed.
On Healthcare IT News, 3 projects were studied. The first project was developed at the University of Manchester. A connected health team at the Center of Health Informatics studied 20 patients at the Salford Royal Hospital. These researchers examined how data captured on a smartphone app could improve doctors' consultations when integrated into electronic health records, or EHRs. During the process, patients would input their symptoms into the app each day for 3 months and recorded the impact that they had on their lives. After the data was collected, it is then integrated into the hospital EHR and summarized as a graph, which can then be shown at outpatient visits. As an outcome, the study revealed long-term trends in symptoms that could have been missed and improved the experience of face-to-face consultations for patients and doctors. Professor Will Dixon stated, by using their smartphone data, patients benefited from consultations being focused around their own data, making discussions more personal.
So the second project encompasses pharmaceutical giant Pfizer and Finnish health tech startup Poppet, and they created an app that supports people on the rheumatoid arthritis medication. And the basic overflow of the application was that patients in Finland, Sweden, and Norway would be offered Poppet's adherence solution, and they would be able to track when to take the medication, so that way they wouldn't forget. The final project that was covered in the article was the digital health company Living With, the Royal United Hospitals Bath NHS Foundation Trust, and the University of Bath. And they also created a profiler of rheumatoid arthritis flares, and this allowed patients to capture disease activity that could be missed by doctors if they didn't properly monitor it. And this was used mostly in doctor checkups.